excited to have you join us today for the first of a three-part series on education and engagement. Today we will be talking about From Keyboard to Care, Synthesizing Digital Content for Program Improvement. We are recording this, just to let you know that, but we are really excited to be able to kick off this education and engagement series. We will have it for the next 2 Wednesdays, every Wednesday at 2 p.m. Eastern Standard Time. But with that, we will get started. Next slide, please. As I mentioned, the webinar is being recorded and there will be a link available online on the Expecting Health YouTube channel. If you have questions, please submit them in the chat box. We will answer all questions at the end of the webinar. We have a lot to present today, so we want to make sure that we get to that. You can also use the chat box if you need some IT help or any technical assistance. Unfortunately, we were not able to have live captioning on this session today, but the recording will have a transcript. Next, please. So our agenda for today, we will start with a presentation from Brianne Miller talking about gathering and analyzing community forum discussion points, followed by Fareed Barkhet, who will be discussing gathering and analyzing questions from an online forum. And they will both speak to the difference between those two and the work that they've been doing over the past summer. The learning objectives are 1, to understand the importance of gathering family feedback, 2, learning the 2 methods of collecting family feedback from online sources, and 3, to draw meaningful conclusions from family feedback as a means to improve newborn screening communication. We want to say thank you to Applied Therapeutics. This series, so both what we're talking about today as well for the next 2 Wednesdays, was due in part to support from Applied Therapeutics. So thank you for that. As I just said, there are 2 more sessions. So next Wednesday, we will be talking about gathering feedback from focus groups and interviews, and we will have Lori Williamson and Norma Jean Simmons discussing that. And then on the 23rd, we will be discussing storytelling through surveys, where I, as well as our Baby's First Test Consumer Task Force member, Allison Wood, will be sharing some experiences that we've had. So there will be a lot of opportunity to hear about different strategies and approaches that people have taken in trying to gather not just the data points of family engagement, but really what you can do with that and how it can be applied for improvement in the different program areas that you work in. Next slide, please. As I hope you all know, we are celebrating Newborn Screening Awareness Month. There is a lot going on. I feel every single day there's something new, but please feel free to use some of the materials that we have created. They can be found on Baby's First Test through our Newborn Screening Awareness Month toolkit. You can easily download that. And we also hope that you will join us on September 17th as part of our Twitter chat that will be taking place at 2 p.m. Eastern Standard. This is a conversation that we've had annually for many years now, and it's always a great opportunity to see all the different partners come together and answer questions about newborn screening and, you know, why are we all so passionate about this? So it's a really great opportunity. Even if you're not very familiar with the Twitter chat, you can get online and kind of watch it go by. So we really encourage you to join us in that. Great, so I will give a short introduction to our 2 speakers. Brianne first came to Expecting Health in 2019. During that time, she completed an analysis of Ask an Expert questions. And if you're not familiar, Ask an Expert is our module where people will send in their questions and we will triage them, Many of them we can answer ourselves, but sometimes we reach out to our partners and other experts to help address those questions. And so she spent her time analyzing those questions and also looking at BabyCenter, which she'll talk a little bit more about what that is if you're unfamiliar. And then in the fall, she joined us as a maternal and child health fellow. Followed by her presentation, Fareed will be speaking with us about some of the work that he has done. He is a graduate student at the University of Michigan, pursuing both a degree in genetic counseling as well as one in health behavior and health education. And he's looking forward to May 2021 when he will be graduating. As an intern for Expecting Health this summer, he did quite a bit of analysis, which he will be presenting, both looking at Ask an Expert and thinking about how we can take all that we've learned from those questions from families to seeing how we can upgrade and update the work that we present out there. So without further ado, I will pass this along to Brianne. And as a reminder, please feel free as questions come up to send them through the chat. We will hold them till the end of the webinar just to make sure we get through everything.
Oh, sorry. I was muted there for a second. Thank you, Natasha, for the introduction, and to everyone for tuning in today. Hopefully you're listening from somewhere a little bit happier and warmer than cold, rainy Iowa. Today I will be talking about From Parent to Parent, Analyzing Community Discussion Posts. So a little background on my project. Our goal was to identify common themes in parent posts on an online discussion platform about newborn screening. This allowed us to assess our programs in communication and identify any points about newborn screening that maybe we were missing or our audience is missing from us. So the purpose of this was to know what our audience wants or needs to know, and this is especially important when you're providing education to families. So this project was completed between April and July of 2019. So a little bit more on the timeline. Natasha and I first started talking about the project in March of last year when I applied for my internship at Expecting Health. And then we really planned out the project in April and submitted an IRB Human Subjects Research Determination to the University of Iowa. We found that we did not need IRB approval to continue with our project. So then we moved forward, and in May, when I started my internship, I started collecting posts and then moved forward with the next steps of the project to develop the codebook and code the posts. And then finally, I analyzed and reported all of the information at the end of my internship last July. I'll go into more detail about each of these steps in a little bit. So the platform, we decided to use BabyCenter as our platform to gather our data from. We reviewed several parenting sites and discussed different ones, but we ultimately landed on BabyCenter for 3 primary reasons. So the first reason is that BabyCenter is one of the most popular parenting websites. There's a lot of literature out there about this, but it's heavily used by new and expecting parents, and their app has been downloaded over 10 million times. And according to BabyCenter, they reach 50 million parents a month with their 10 different websites. And this was really important to us to reach as many people as possible with our project. And also BabyCenter is cited by moms as the most liked parenting website, which is also important. And they provide us with the opportunity to get at parent feedback through their community discussion platform. So BabyCenter allows parents to receive information, but it also allows them to talk back and forth with each other on their community forum. This is where we got our information from, so obviously that was important to us. So when we were looking at the posts on BabyCenter, we established different inclusion criteria. And the first thing that we did was we set a date range. We elected to use posts between January of 2015 and May of 2019. We chose this date range for several reasons. Obviously, we wanted the posts we were looking at to be current and reflective of parents' current concerns or questions about newborn screening. And this timeline is also very similar to when Ask an Expert on Baby's First Test was created. So we wanted to look at a similar timeline to that. So if we could do any comparison between the two, that was relevant as well. And also this timeline also just gave us a decent amount of posts to look at. We didn't want our data set to be too big or too small. And we found that the posts between these dates were just about right. So we wanted also our posts to mention newborn screening, obviously. That was important. And they needed to be original discussion posts on the community forum. We didn't want to analyze BabyCenter produced information or comments from other parents on other posts. So we really wanted these to be original questions and posts from a parent. And if the post mentioned that it was from outside of the United States, we excluded those because our program is based in the United States and we really wanted to focus on those parents' questions. And if the posts weren't in English, we excluded them as well. As you can see, just by narrowing down the search to original posts, it reduced the amount of information we had to sift through to find what we were looking for significantly. Another thing we needed to do was make sure that we were gathering all posts that were talking about newborn screening on BabyCenter, even if they weren't being referred to directly as newborn screening posts. So newborn screening has a lot of different names that it can be referred to as by parents and even healthcare providers. So it was important that we established a list of search terms to pull out these posts from the numerous posts on BabyCenter. So we landed on this final list of search terms: newborn screening or testing, NBS, metabolic screening, heel stick, prick or poke screening or testing, neonatal screening, and PKU screening. The ones that are in bold gave us the highest yield of newborn screening posts from BabyCenter. So we can see that it was really important that we included heel stick and PKU screening in our search terms because they gave us quite a few posts as well. So then I moved ahead with gathering the posts, and it was quite the process of sifting and reading through, making sure we had the right ones, because BabyCenter doesn't allow you to search directly for like specific terms. So when you type in newborn screening, any post that mentions newborn or screening separately also came up. So we really wanted to make sure that they were about newborn screening specifically. So that was part of our process to review and make sure we had the right set of posts. And then when we pulled them into Microsoft Excel and pulled the post contents and also the date they were posted, just so we could verify that they were in our date range. And this is at the bottom, a screenshot of our Excel sheet. And at the end, we had 317 parent posts on BabyCenter that we analyzed. So for our analysis, we elected to do a qualitative content analysis. We did this by developing a codebook and then coding each of the posts with that codebook. And I'll go a little bit more in detail about what that means. So coding is a common technique in qualitative analysis for condensing data into identifiable topics. And you do this by developing a codebook, which is your set of codes and specific descriptions for each code. So there's a screenshot of 4 of the codes we landed with on the right side and descriptions for each of those codes. It's really important to have descriptions that make sense for your codes and are also distinguish them from any other codes. So for our codes, we really wanted to make sure that they were all different and that each thing we were coding wasn't falling into multiple buckets. And that's really important to remember when you're doing qualitative coding. You can do deductive or inductive coding. Deductive coding is you have predetermined codes that you're looking for in a data set. So you set the code book prior to looking at any of the data, which is how we actually started our process, but we went through a few cycles with the code book and we decided to do more of inductive coding, which is you create codes to match the data set and what it is telling you. It's often a really iterative process and requires a lot of back and forth to make sure you really land with a code book that suits your data set. So as I mentioned, when we developed our code book, we started with an existing code book. It was used for previous analyses of Ask an Expert questions, and it had 10 overarching categories that were like key aspects of newborn screening, including procedures, results, timing, etc. We used this code book. We initially coded the data set using these codes, and we found that there was just something missing from the data. We weren't getting really what it should have been telling us or what we wanted to know. So that data review was really, really important to developing our effective code book. And our final code book had 16 categories, and it was not very different, but slightly different from our original one in the fact that we factored in social support. All of the posts on BabyCenter were looking for social support in some way. So we really wanted our codebook to highlight those different aspects of social support and then also the different areas of newborn screening as well. So we landed with these 16 codes, which you can see here. And you can kind of see how they're broken up by aspect of newborn screening as well as type of social support. So we had expressions of worry or fear, seeking previous experiences, seeking support or interpretation. And then for aspect of newborn screening, we focused on results, follow-up, procedures, and then blood spot storage or research. But you can also see that we left some of the more generic categories as well for like explicit questions about newborn screening or newborn screening advocacy. So for the coding process, there are 3 different steps. So the first step is to independently code the data set. We had 2 team members do that, myself and Dr. Aaron Goldenberg was kind enough to help me with this project. So he also coded the data set. And then once the coding was done on both of our parts, we came together and talked through each code and made sure that there weren't any discrepancies or issues with the code book, that we were interpreting it differently. And then if there were, we discussed them, made our case for why we coded it the way we did, and then determined the final code of best fit. So we actually found that since the posts were so rich, that oftentimes the post needed more than one code because the parents were making more than one ask or statement throughout their post. So each post could have been placed into up to 3 different codes. So that landed us with 500 total coded statements from our original 317 posts. So then we moved into analysis and we took the codes and analyzed them in 3 different ways. So the first thing we did was unique code frequency. We wanted to know how many times each code was appearing in the 317 posts. Then we also grouped them together and called them overarching themes. So we did this based on type of social support and analyzed those that were most common or least common. So that was previous experiences, worry or fear, advice or interpretation, well wishes, and then other. So any other question about newborn screening. And then we also kind of broke down our key subcategories, which were worry or fear and previous experiences based on aspect of newborn screening. So we found that our most common codes are these 5 here on the left: seeking previous experiences with newborn screening results, worry or fear about newborn screening results, previous experiences with newborn screening follow-up, previous experiences with procedures, and then support or interpretation of newborn screening results. So from that, you can really see that newborn screening results was a key area on BabyCenter, and it was the most common category of expressions of worry or fear, seeking previous experiences, and support or interpretation. So parents on BabyCenter are really talking about newborn screening results more than any other aspect of newborn screening. And 45% of all of our posts were about newborn screening results. So that's a really key finding, I think. And 45% of requests for previous experiences were about newborn screening results as well. So while the numbers are important, it's also really important to listen to what the parents were saying. And I think some of these posts really tell stories for themselves. So I wanted to share a couple. The top one is what we considered an expression of worry or fear about newborn screening results. This mom is just really saying how scared she is and how worried she is about her child. And I think that's really enlightening on the topic. And then the bottom one is an example of what we considered a request or seeking previous experiences with newborn screening results. Just wondering if anyone else out there is dealing with it as well. They're looking for that social support around their newborn screening result. Okay, so now I want to talk a little bit about strengths and limitations. Strengths to this approach are that it's a relatively simple, low resource method of analyzing parent feedback. You just need access to the internet and an Excel spreadsheet. So that's really a positive to this approach. It allowed us to access perspectives and feedback from a variety of parents that we maybe wouldn't have been getting feedback from in our other methods of seeking stakeholder feedback. So that was really important to us as well, that we could reach a wide audience. And obviously BabyCenter is a public website, so it's a public data set that we could access really easily, and it can be used for analyses on a whole ton of different things related to parenting, but we chose newborn screening. And then also it's easily replicated, so we can continue to do this in the future for continuous quality improvement of our programs. And I think that's really great too. And then limitations is obviously we don't know who these parents are, so we don't know if where our representation is coming from. And individuals with negative experiences with newborn screening or more alarming experiences may be more prone to seek out this type of social support and go to these platforms and share, which we saw because there were only 2 newborn screening advocacy posts on BabyCenter. So that's something that we need to keep in the back of our minds as well. And then also we don't have any feedback from someone who might not have internet access by using this method. And then obviously I talked a little bit about it earlier, but the search method on BabyCenter is imperfect. So that's a limitation as well. So moving forward, we learned a lot about the importance of connecting with other parents for those receiving out-of-range newborn screening results. And technology is a really key tool to us accessing this feedback, as well as providing education and support to these families. The parents posting wanted to know more about the result and be able to interpret it for themselves. So we should continue to help them do so. And then continued collaboration and communication. We just need to continue working together to make sure that we're providing parents with the information and resources they need to participate in newborn screening actively and positively. I just want to acknowledge Natasha for helping me come up with this project and the design, and also supervising me while I did it. And also Dr. Goldenberg, as I mentioned, he was an advisor on the project and really helped me with coding and the codebook development. My email's on this slide if you have any questions or want to be in contact with me after this is over. And here are my references. Thank you so much for your time and attention. I will now turn the control over to Fareed to share about his project.
Right. Thank you, Brianne, and hello, everyone. I'm excited to be able to present on this project. This is really what I worked on during my time as an intern with Expecting Health. So today I'm going to talk to you about my project titled From Parent to Expert, Analyzing Questions from an Online Form. So you'll see a lot of similarities with the project that Brianne just described, but I also think that we have some key differences on what the purpose of the two online resources are. And while Brianne's project was focused on a community resource where parents are really looking for shared experiences, it's very different when we are in a educational website where really it's for more information. So we wanted to really understand what are the differences in the type of information that parents are seeking in these different resources. So the goal of the project was to identify the frequently asked questions that were submitted by family members or the general public through an online form on the Baby's First Test website. And the ultimate purpose was so that we could better understand what are our stakeholders' educational needs, what are their information-seeking behaviors, and what is not currently being met, so that we can use that to update our educational materials, create new programs, and also streamline the question response process so that our users have access to the information faster and more effectively. So this project was completed between May and July 2020. And then there are, there might be plans for continuing analysis depending on, the findings. So to give you a better view of the timeline, I do want to acknowledge that this project, emerged sort of as a legacy project from what Brianne described from the summer 2019 when they had done the previous analysis of the Ask an Expert questions. So this was a continuing analysis, but also with a slight different focus that I'll get into a little bit later. So in May 2020, we started the initial project planning and development, and then used pretty much all of June to develop the code book, code the data, and then utilize July for the data analysis and report. And we're currently in the dissemination and follow-up phase of this study, of this project. So Natasha introduced a little bit about Ask an Expert, so I just want to give you some more information about how it's maintained and how it's managed. So it exists as part of the Baby's First Test website, and hopefully you're all familiar with Baby's First Test. It is the nation's newborn screening education resource center for family members and healthcare professionals, and it's really intended to be sort of a one-stop shop for all educational needs related to newborn screening. With that being said, while there's a lot of really valuable information in Baby's First Test, there might still be questions that are not as available or as readily available on the website. So the Ask an Expert contact form was created in September 2016 so that expecting and new parents who are visiting the Baby's First Test website could ask any questions that they had about newborn screening. And the way that it is managed, once a question is submitted, the Baby's First Test staff reviews the questions, and the questions are sent to the identified expert, and that may be a member of Expecting Health staff, or if it requires more specialized knowledge, we may contact other healthcare providers, public health state officials, newborn screening state coordinators as appropriate. And then once we have the appropriate answer, we then email the answers to the individual who submitted it. And all of these questions and every response to these questions are recorded in an Excel sheet format by the program coordinator that includes a timestamp of when it was submitted, when it was responded to, when it was followed up, et cetera, et cetera. So it's very valuable for multiple different types of analysis and measurements. So this is just what it looks like on the Baby's First Test website. So you'll see on the left that there's a panel. That panel is actually shown in most of Baby's First Test pages, so that even as people are reading information, if they want more information, they can very easily access it and then go to the main site, which looks like what's on the right, where they can introduce their email, submit their question, and that gets directed to members of the Expecting Health staff. So for our analysis, we wanted to really take a look at all of the questions that have been submitted on Ask an Expert since its inception. So the date range was from September 2016 to June 2020. And that really gave us a lot of data to work through. And similarly to the BabyCenter project, we were looking for all questions that were submitted in English. Also, questions that were complete and coherent, meaning we could understand what the question was trying to really tell us, because there were some character limits on the form and sometimes questions were cut off, or we just really couldn't understand what the individual was saying. So we excluded those questions from analysis, and we also excluded any duplicates for any questions that might have been submitted twice. And it got a little bit cut off here, but it wasn't 73 total questions. The total was 573 questions that were included in the final analysis for this project. So it was a pretty robust data set from 4 years of data. And we took a very similar approach where this was really a mixed methods project, where we started with qualitative content analysis, doing coding as Brianne described, and then doing a codebook data categorization, which I'll talk more into, and then use that created codebook, then do a quantitative analysis with descriptive statistics. So, I won't go too much into the coding process since Brianne gave us a very good overview. So I just want to let you know that we use the previously created codebook as described as a framework to develop our new codes. So we did use a deductive approach, but then similarly, the created codebook was in very general terms. And for this project, we really wanted to get into what are the specific questions that parents are asking. So we wanted to create more specialized codes. So through a preliminary data analysis, we created new codes. So we followed an inductive approach there. And once we had our codebook finalized through the iterative process, we assigned primary and secondary codes to each question to help with the categorization later. So you can see here just the flow from what I just described. And what I just want to highlight here is when we finalized the codebook, we ended up with 45 total unique codes that were used as either primary or secondary codes for each question. And these codes were reanalyzed for applicability on multiple occasions and adapted to reflect the concepts that we were really trying to nail down. And then once we had these codes, now we wanted to categorize them in a way that, if we could really pinpoint what the question was about, what subcategory, and what was the specifics. So we used a hierarchical framework to group related codes into a primary category, and then utilizing the secondary codes to further group the questions into secondary and tertiary subcategories. And in this process, we ended up excluding any questions that were non-newborn screening related. So while they were part of our original codebook, when we did our final categorization, we excluded these questions because we really were trying to get into what are the educational needs around newborn screening. But I still think that it's helpful to mention because there is a significant amount of questions that were not about newborn screening, which indicates that there might be a misunderstanding about what newborn screening is or about what Baby's First Test is. So that could also guide future analyses. We then reanalyzed the grouped codes to validate their specificity, making sure that all of the questions that fit under a subcategory were related to each other. And to further validate that our categories were, they're valid, we also did an analysis of the responses to the questions. And the logic to that was, if we could take the response from one question in a subcategory and it could be used to answer another question in the same subcategory, then those questions were truly related. So that allowed us to further validate our codebook. So through all of this, the primary categories of our codebook, just indicating what were the broad topics that family members and parents were seeking questions about in newborn screening. You can see it's actually pretty comprehensive and encompasses all relevant aspects to newborn screening. So result interpretation, how to access results, how long does it take, when you should do it, what happens if you, how do you follow up from results, et cetera, et cetera. So we ended up with 10 primary categories. And I'm not gonna go through all of the subcategories, but just to give you an example of how we create our hierarchies, you can see here at the top, we have our primary category of timing, and then that was subdivided into subcategories, of related things like when is the ideal timing, what happens if you do it later or earlier than the ideal timing, and then after results, when should you follow up, et cetera. And those were even further subdivided into the tertiary categories to really narrow down what were the specific questions. So under each of these tertiary subcategories, there are related questions under all of those. And again, we did this for all of our 10 primary categories. And once we had created this codebook, then we went into our quantitative analysis using descriptive statistics to figure out what were the total number of questions per category, the total number of questions per year, frequency, what was the average response time for each of the questions, and what was the follow-up rate, meaning how often did they ask a follow-up question, or how often did we need additional information and that was provided, because those are all helpful metrics for what we'll discuss in the results. So without going into too many specifics, what we found just broadly is that most questions that were submitted through Ask an Expert were indeed submitted by parents or family members of a baby undergoing newborn screening, which does match with sort of, the expectation and the use for baby's first test. There were also other users that included healthcare professionals, students, researchers, public health officials. We are a little bit limited in, how much we can categorize who each person is, because it is an anonymous form. How we determine if it was a parent or a healthcare provider was if they specifically mentioned it in their question, or based on the language of the question, could we determine what their likely category was. And for all the primary categories that we had, there was an average of 30 questions per category of those 10 main ones. And there were some that were overrepresented, some that were underrepresented. The most common types of questions were everything that had to do with results. So particularly the interpretation of results was the most common, but also how long the results take, how to access results, and also a significant amount of people were asking about, how accurate are the results, looking for false positive rates, false negative rates, and just seeking validation to see, does this really mean what, that my child has a condition? And then some of the least common, but still, significantly, mentioned questions had more to do with procedures. So how is newborn screening done? Privacy surrounding blood spot research, and then questions about genetics and some of the genetics of newborn screening conditions. Some of the trends that we saw on the data that are helpful for Baby's First Test as an organization and Expecting Health, we did see that the use of this contact form has remained steady since 2017, which was the first full year of the program. And we're averaging more than 100 questions per year, with approximately 165 submitted each year between 2017 and 2019. It did not include 2020 in the analysis, just because it's not done yet. But the trends does indicate that we might be around there by the end it continues. And something that was interesting to see was that 50% of the questions submitted approximately were broadly generalizable, meaning we could provide an answer and use that same text to answer all of the related questions in those subcategory. And I think that those are attractive questions to know about because those are the ones that we can most easily create content for on a website or for an educational program. So it's helpful to see there. And then the remaining 50%, while I say here they're individual or situation specific, that doesn't mean that they're not generalizable. It just means that they're less generalizable. Sometimes it's specific to a state or specific to a condition where we can still create materials that apply to most of the questions. And then there were just the ones that were very highly individual, that were like about a specific test result or specific range where they're not generalizable. But also interestingly, of the questions that we categorized as generalizable, nearly 60% of them could be answered with information that was already available on the Baby's First Test website. So that really is telling us that while people are using the website, they might not be accessing the content in the way in which we planned, or they might not, it might not be intuitive how to get to the content. So that can inform, potential, redesigning or updating the website layout to make it more intuitive for parents to access the information that they're seeking. And another interesting piece was that there was actually a relatively low follow-up rate where, in about, 50% of questions, we really needed additional information, but only about 22% of the time did the person who submitted the question originally respond to our attempts at follow-up communication. So that does limit, how much we can take from these results, because we are not sure if we're truly answering all of the questions that they have, and then we're not able to get all of the appropriate information all the time because we need more data before we can give them an accurate answer. So that was an important limitation here. So overall, there are multiple strengths and limitations to utilizing this approach for gathering stakeholder feedback. Similarly to the BabyCenter project, this is not resource intensive. The work was completed over the course of a few months by one person, and we did not require any specialized software. This was all done utilizing Excel. And while specialized software could be helpful, it is not necessary. Also, particularly, it's widely accessible. The Baby's First Test website is accessed through people from all 50 states in the country and the territories of the United States, as well as even some international people. So we can really obtain a large data set from multiple stakeholders, and we can turn those parent questions about specific educational needs into a data set to collect feedback on the newborn system. And it is easy to implement for organizations that already have a website or a contact form. So this can be broadly applicable to any other organization seeking specific feedback on their services or on their state services. That being said, there are some limitations. So it does require users to have prior knowledge of the organization and to already be visiting the website. So they are likely to already be highly motivated individuals to seek information, and thus their educational needs might not represent those of the general population. But nevertheless, it's still useful information because we can get some information on a specific category of respondents who are seeking information on newborn screening. And then, as mentioned, the limited ability to follow up with users is a limitation, because again, sometimes we can't be sure if we're truly answering the question and families are satisfied with the information that we provided, or if they still had questions but just didn't want to follow up. So that's another limitation to this approach. With that being said, we're excited about what are the potential applications of utilizing this data and how can this be used. So as I mentioned, we can create new content or redesign the website content so that it is more intuitive for family members or website users to get to the information, so that that may decrease the number of questions if they're able to easily access what they're looking for. It's also, really valuable to identify the information gaps. So I mentioned, 60% of the questions could be found on the Baby's First Test website. That means that 40% of the questions could not be fully answered on the Baby's First Test website. So if those questions are being asked frequently enough, that's really what can guide, new content creation, new resources, and new program development to address these educational needs. And then lastly, we can streamline the question response process. So knowing that there's a limited ability to follow up, we can update the form to capture as much information as we can to give a response, and thus reducing the need to follow up. And then knowing that there are similar categories of questions, we can really be reutilizing some of the same language for the responses to answer broadly that ensures consistency in the information that different stakeholders are getting, as well as reduces the burden on the program coordinator of writing responses and the time that it takes. And with that, that is it for me. So I would just like to acknowledge the other members who worked on this project. So Natasha, who was our supervisor and assisted in the development and kind of the envisioning of the program. Brianne, who assisted with the codebook development from her previous project. And then Annie Evans, who is the Ask an Expert program coordinator for Expecting Health and Baby's First Test. So thank you all for your attention.
Great, thank you so much to both of you for presenting that. And one thing I wanted to mention that both of these highlight is, we created the Ask an Expert, and it's more than just a contact form, but it does serve that purpose in terms of people going in and just asking questions really quickly and getting responses. And we realized, for the first part, we really focused on what were we answering, how were we addressing the questions, but knowing and thinking about it a bit more, that the questions that came in actually were of great value to us in terms of seeing what are the touch points with families, what were they thinking about. We did a general look at did the types of questions coming in year over year change dramatically? They did not. Was there one year where privacy was the topic, even though on maybe in the newborn screening community, that was a really hot topic, or timeliness was a really hot topic. Did the questions that we get reflect that? It did not. The questions were really consistent as Fareed laid out. So even with that, we were able to then really think about, well, how do we want to make sure that we're meeting the needs? And we didn't need to do a survey or a focus group to do that. We really just worked with what was there. And that's one kind of takeaway that we want you all to think about. What is the information you already have or are already receiving from the families and individuals you're interacting with, and see, could you spend the time categorizing that as opposed to, thinking you have to do a big survey or do a focus group, especially right now when that's a little bit harder than maybe it has been in the past. So please feel free to send in any questions that you have. I will jump in with the first question that we have for Brianne. You analyzed both posts from BabyCenter and Ask an Expert through Baby's First Test. Did you see any similarities or differences between those two data sets, especially since at a very high level, it's parents asking questions about their kids in a pretty similar timeline?
Yeah, so I think the first thing to remember is that they're very different data sets. And so BabyCenter are parents talking to parents, and they also kind of have free range to ask whatever they want or say whatever they want. And they can just type for days, which we saw. Some of the posts were very, very long and detailed. And Ask an Expert is structured specifically so we can get their questions from them and answer them. So we really get less of that noise, which was what was so valuable in the BabyCenter project. But I think the biggest similarity between the two of them is that most of the questions we get on Ask an Expert are about newborn screening results from parents. And that was also a big takeaway from the BabyCenter analysis as well. And this really just shows us that parents are going to multiple sources to find information about their results and to understand newborn screening results outside of their healthcare provider. They might be going there for information, but they're also using Ask an Expert forums and BabyCenter and talking to their peers. So they really want that information from different levels. And I think it's just important to remember that we should continue to provide it to them in those different ways as well.
Great, thank you. The next question is for Fareed. You mentioned that 60% of the questions could be answered by content that was already on Baby's First Test. Do you have any ideas as to why users chose to go through the contact form, even though the technical answers were already there? Is it a navigation issue, do you think, or is it more, I know when I call a credit card company, I always kind of tap through and say, I want to speak to a representative, wanting at least something that feels more like a human connection as opposed to more stagnant content. I don't know if you have any ideas on that.
Yeah, so I think it's hard to know what was the behavior of the users before they decided to submit the question. But I think what really this is highlighting is that even though that you are creating content and making it publicly available, it doesn't necessarily mean that it's reaching your audience in the way that you intend it to. So I think there are multiple reasons. Some of that can be just ease. Some people might just give me the answer to my specific question. I don't want to have to read through all of this. And that could be valuable information. Maybe do we really need as much information, or can we really condense it into what are the key takeaways, or providing a key takeaways summary at the end of a page, something like that. The other could also be that maybe it's just not intuitive how to get to the information. If the information on genetics is found on the newborn screening 101 page, is that intuitive for a family member to know that that's where they need to click to really understand inheritance, or can we streamline the process? So I think it just highlights the need for not just creating something and letting it exist stagnant, but constantly reevaluating what materials you're putting out there and how they're reaching your audience. So highlights program evaluation is a very important piece in any public health effort.
Great. And let me see, there's another question. This is for both of you. How do you feel that the analysis that you conducted could be used for the broader newborn screening community? Whoever wants to go first can go first.
I can go first. I kind of touched on it at the end of my presentation, but just continued collaboration in newborn screening. I think we do a really great job at having all of the different stakeholders at the table, and researchers and healthcare providers and families. And I think we really just need to continue to do that work and evaluate the way we're communicating with families and making sure that we're getting them that information, because I think it's easy to think, oh, we have this really great communication piece, but like the families are definitely getting it. But I think that we kind of realized from BabyCenter and also Ask an Expert that that's not always the case. So just making sure that we're continuing to provide this information and education to parents, and also just make sure we're continuously evaluating if they're getting it, and finding new and innovative ways to get that information to them is important as well.
Yeah, and to follow up, I also think, while, the analysis that we created on Ask an Expert, for example, is specific to our stakeholders as Baby's First Test and Expecting Health, it may not necessarily be that it are the same needs that, state health departments have or that local hospitals have. So, while, conducting these national analyses are helpful to, determine overall trends, what we also know is, that, panels are different in each state, methods, false positive rates, the information that is needed is different. And perhaps instead of, family members, other organizations are really getting more questions from researchers, or they're getting more questions from hospital workers. So I think utilizing these type of resources can really get you to better understand who is accessing your information, who is really your target audience, and are they the ones using the information, and what are their specific needs in the context of your role in the newborn screening system.
Great, thank you. Well, we are at the top of the hour, and so thank you so much to our two speakers. I want to say that if anyone is interested in learning more in terms of how we coded, the different categories we came up with, anything like that, that would be helpful as you start to look at how you are analyzing and thinking about the information that you're getting from families, please reach out to us. We like to do this work and then be able to share what we learned, both in terms of the content, but also the process along the way with our partners. So thank you again for joining us today, and we hope to see you here next week, next Wednesday at 2 p.m. for our next session around engagement and education in newborn screening. Thank you so much and have a great day.